So very good morning to all. So today we will be dealing motility disorders of the esophagus. Okay. So can any one of you guess? So what are the motility disorders of esophagus? Yeah, it is nothing but the achalasia cardia. So the word achalasia meaning failure to relax. Okay. So the definition goes like this. It is a idiopathic motility disorder which is characterized by loss of peristalsis in the distal two-third of the esophagus as well as impaired relaxation of the lower esophageal sphincter. Okay. So here there is no peristalsis in the distal two-third of the esophagus as well as impaired relaxation of the lower esophageal sphincter, and it is mainly due to absence of or back plexus of nerves. Okay, due to absence of or back plexus of nerves. One more term is there, that is pseudoachalasia. Okay, that is due to adenocarcinoma of the cardia. Okay, and it is a pre-malignant condition and it mainly predisposed to squamous cell carcinoma. Okay, so it is a pre-malignant condition predisposed to squamous cell carcinoma. And let's study what are the causes of achalasia cardia. In the definition itself, we have studied that it is a idiopathic cause. Okay, first cause is idiopathic, second one is stress related, and the third one, that is vitamin B1 deficiency. So vitamin B1 is also known as thiamine. So thiamine deficiency. Okay. Next one, Chagas disease. So can you, any one of you tell the other name of Chagas disease? Yeah, trypnosomia. Okay. So Chagas disease. So this is also one MCQ question. So most common cause of secondary achalasia cardia. Actually, the classification of achalasia cardia goes like this, primary as well as secondary. So most common cause of secondary achalasia cardia is Chagas disease. Okay. Next one is corkscrew esophagus. So 5 causes: idiopathic, stress, vitamin B1 deficiency, Chagas disease, and corkscrew esophagus. Okay. Next. So in which age group it is more prevalent? It is mainly around 20 to 40 years of age group, mainly female sex predominant. Okay, 20 to 40 years and female sex predominant. Okay, next, symptom. So this is a very important MCQ question, that is progressive dysphagia. That is more for liquids than for solids. That is progressive dysphagia, more for liquids than for solids, and also chest pain because of regurgitation during night. So more for liquids than for solids, along with this chest pain and regurgitation during night time. Let's directly enter into diagnosis session. Okay, in the X-ray we can see pencil shaped smooth narrowing of the lower esophagus. Okay, in the barium swallow we can see bird beak appearance as well as cucumber esophagus. It is nothing but the dilatation of the proximal esophagus. Next one is absence of fundic gas bubble. Then sigmoid esophagus or mega esophagus. So X-ray we can see pencil shaped narrowing. In the barium swallow we can see bird beak appearance, dilatation of the proximal esophagus or the cucumber esophagus. Then absence of fundic gas bubble. Then sigmoid esophagus or mega esophagus. Okay. Next, the golden standard investigation for achalasia cardia is manometry, okay, which shows elevated lower esophageal pressure more than 25 mm of Hg with loss of peristalsis. So this is also one MCQ question, okay. So golden standard investigation is manometry. And in the CCK test, this is not that much important, but more points to know, that only. Okay, so normally CCK causes relaxation of the lower esophageal sphincter, but here there is paradoxical constriction in the achalasia. So usually CCK causes relaxation, but due to achalasia there is paradoxical constriction. And the treatment, that is also one MCQ question, that is modified Heller's myotomy. Okay, so treatment is modified Heller's myotomy. So next we will be entering into MCQ. Okay, so radiological feature suggestive of achalasia cardia is absence of gastric air bubble or fundic air bubble, air fluid level in the mediastinum, sigmoid esophagus, then all of the above. Yeah, answer is option D. So next, feature of achalasia cardia include all of the following except increasing difficulty in swallowing, more for liquids than for solids, then regurgitant vomiting, dilated and elongated esophagus, irregular filling defect. Yeah, answer is option D. Defect in achalasia cardia is present in Meyenteric plexus of Orbach, Meissner's plexus, Kieselbach plexus, mesenteric plexus. Yeah, answer is Meyenteric plexus of Orbach. Okay. Dysphagia, which is more for liquids than for solids in a 25-year-old female. So more for liquids than for solids. That is nothing but the achalasia cardia. Okay. Then barium meal X-ray shows persistent bird beak appearance. It is nothing but in achalasia cardia. Corkscrew esophagus. That is also one very important MCQ question. Corkscrew esophagus. Any idea? Yeah, it is nothing but the diffuse esophageal spasm. Okay. In achalasia cardia, true is pressure at distal end with no peristalsis, low pressure at lower esophageal sphincter with no peristalsis, pressure more than 50 mmHg with peristalsis. Yeah, answer is option A. So hope this topic is clear for you. Any doubt you can ask directly in WhatsApp. So thank you. Thank you for listening.